6 fruits seniors might want to think twice about. Health concerns to consider. Did you know some fruits considered superfoods could actually harm seniors? As a doctor who's worked with older adults for over 25 years, I've seen patients hospitalized because of a common breakfast fruit. In today's video, I'll share 6 fruits seniors should think twice about eating. Not because they're bad, but because bodies change subtly after 60, and many people don't realize it. The next few minutes could help you avoid unexpected health risks and live healthier, happier each day. If you're caring for your parents, grandparents, or are a senior yourself, stick around till the end, because good health starts with the little things. 1. Star fruit. A potential danger for seniors. Star fruit looks healthy but can be seriously dangerous. Star fruit, with its pretty star shape and tangy flavor, is often seen as a healthy snack. But for people over 60, especially those with weakened kidney function, it can be seriously risky, even life-threatening. Here's why star fruit can be dangerous. It contains a neurotoxin called caramboxin. This natural neurotoxin is usually no problem for younger people or those with healthy kidneys, as their bodies can easily process and eliminate it. However, older adults often have reduced kidney function, meaning their bodies can't get rid of caramboxin efficiently. This leads to a buildup of the toxin, causing neurological problems. A worrying statistic: about 1/3 of Americans over 65 have impaired kidney function without even knowing it. This means they could easily eat star fruit and experience serious consequences without understanding why. Star fruit poisoning symptoms. Mild symptoms include nausea, vomiting, insomnia, confusion, and dizziness. Severe cases can lead to seizures, loss of consciousness, coma, and even death if not treated promptly. So while star fruit might look and taste great, it's best to err on the side of caution, especially if you're over 60 or have any concerns about your kidney health. Talk to your doctor if you have any questions. John, a sprightly 72-year-old from Tampa, Florida, thought he was doing his body a favor. Every morning, he'd blend up a healthy smoothie, a vibrant mix of fruits and veggies, always including his favorite, star fruit. He felt great, energized for his day. But then, things took a turn. Over a few days, a strange fog settled in. He felt confused, dizzy, his head swimming. It escalated quickly, leading to a terrifying emergency room visit. The doctors ran tests, puzzled by his symptoms, until they discovered the culprit: the seemingly innocent star fruit in his daily smoothie. It turned out John had mild kidney problems, something he wasn't even aware of. The star fruit, in his case, triggered a neurological reaction, a kind of poisoning. It was a real wake-up call. After several days of treatment and careful monitoring, John recovered. Looking back, he shakes his head, still a little amazed. "I couldn't believe it," he says, his voice filled with a mix of relief and disbelief. "I mean, fruit, it's supposed to be good for you. I never imagined something so seemingly healthy could land me in the hospital." His story serves as a potent reminder. Even seemingly harmless foods can have unexpected consequences, especially if you have underlying health conditions you might not even know about. It's always a good idea to chat with your doctor about any dietary changes, especially if you have any pre-existing health issues. Hey everyone, a friendly heads up from the health organizations. The National Kidney Foundation and the CDC are sounding the alarm. If you have kidney disease, steer clear of star fruit. Even a tiny bit can cause serious, fast-acting, and unpredictable problems. It's really not worth the risk, so just avoid it altogether. Your kidneys will thank you. Safe alternatives to star fruit. Looking for a delicious and safe swap for star fruit? Here are a couple of great options that are both tasty and good for you. Asian pear. These pears are wonderfully crisp and refreshing. They're super easy on your digestion and, best of all, completely toxin-free. Think of them as a naturally sweet and healthy snack. Dragon fruit. Dragon fruit is another fantastic choice. It's delightfully cool and packed with fiber, making it great for your gut. Plus, it's naturally toxin-free, so you can enjoy it without worry. It's a fun, vibrant fruit that's both healthy and delicious. 2. Grapes. A sneaky enemy for seniors, especially those with diabetes. Grapes. Sweet, but with a secret danger. Those juicy, sweet grapes look like a healthy snack, perfect for seniors. But for folks over 60, especially those with blood sugar issues or taking medication, grapes can have some serious, unexpected consequences. Let's talk about why grapes can be a risky treat after 60. Blood sugar spikes. A single cup of grapes, about 150 grams, packs a sugary punch, roughly equivalent to 4 teaspoons of sugar. That's a lot for older adults. The American Diabetes Association (ADA) points out that almost 50% of Americans over 65 have diabetes or prediabetes. Grapes have a high glycemic index, GI, meaning they cause a rapid spike in blood sugar. This can lead to fatigue, dizziness, cardiovascular problems, vision issues, and even diabetic comas. Think about Patricia, a 68-year-old from Chicago. She swapped her afternoon cookies for what she thought was a healthy bowl of grapes. Within weeks, she experienced severe blood sugar fluctuations, impacting her vision and mental clarity. Her doctor traced it back to the grapes, too many and not balanced with other foods. Choking hazard. This is a danger often overlooked. Those round, slippery grapes can easily slip down the throat. As we age, our swallowing reflexes weaken, increasing the risk of choking, gagging, and temporary breathing stoppages, potentially life-threatening situations. The National Safety Council, NSC, reports a 30% increase in grape-related choking incidents among seniors in the last 5 years. So, while grapes are delicious, it's important for seniors to be mindful of portion sizes and potential risks. Moderation is key. And always consult your doctor or a registered dietitian if you have concerns about your diet and health. Safer substitutions. Better-for-you swaps. Strawberries and blueberries. Low sugar, packed with antioxidants, and super easy to digest. These little guys are a fantastic choice for a healthy and delicious snack. Plus, they're naturally sweet, so you don't need to add anything extra. Cantaloupe, cubed. Sweet and refreshing, cantaloupe is wonderfully mild and easy to chew. Cubing it makes portion control a breeze, no more accidentally grabbing a huge chunk. It's a great way to sneak in some extra hydration too. If you're still craving grapes, here's how to enjoy them safely. The key is to cut each grape into fourths. Think of it as grape deconstruction. Then, limit yourself to a maximum of 6 grape pieces at a time. This helps prevent a sudden blood sugar spike and minimizes the risk of choking. Pro tip: pair your grape quarters with a little protein, like a small piece of cheese. The protein helps slow down the absorption of sugar, making the whole experience more enjoyable and less likely to cause a sugar rush. So go ahead, enjoy those grapes. Just be mindful and take it slow. 3. Oranges. Surprising health risks after 60? Oranges. Immunity booster or senior health hazard. For years, oranges have been touted as the ultimate source of vitamin C, a key player in boosting immunity. But for folks over 60, especially those with stomach issues, existing medical conditions, or dental problems, that juicy orange might be more trouble than it's worth. Let's dive into 3 reasons why oranges aren't always the miracle fruit for seniors. Acid reflux. Rumble. Oranges are packed with citric acid, which can really irritate the stomach lining. The GERD Foundation points out that over 60% of people over 60 deal with gastroesophageal reflux disease, GERD. Starting your day with a glass of orange juice on an empty stomach, that's a recipe for increased acid production, leading to heartburn, bloating, sleepless nights, and a generally lower quality of life. Think about Margaret, a 73-year-old from Minnesota who religiously drank orange juice for an immunity boost, only to suffer from persistent heartburn and insomnia. Once she cut out the orange juice, her reflux improved dramatically. Medication mayhem. Oranges and other citrus fruits can interfere with the absorption of over 50 common medications used by seniors, including blood pressure medication, cholesterol-lowering drugs, and antidepressants. Timing is everything. Eating an orange around the time you take your meds can significantly reduce their effectiveness or even cause adverse reactions. It's like a tiny, delicious saboteur, undermining your treatment plan. Tooth trouble. As we age, our tooth enamel naturally thins, making our teeth more vulnerable to the erosive effects of acidic foods like oranges. The result? Sensitivity, cavities, and potential discomfort that can impact your enjoyment of food and your overall smile. It's a bit of a bummer when something so seemingly healthy can cause such dental distress. So, while oranges offer some nutritional benefits, it's crucial for seniors to be mindful of potential downsides. If you're over 60 and have any of the health concerns mentioned above, it might be wise to limit your orange consumption or talk to your doctor before making orange juice a daily habit. Your body will thank you. Hey there, Dr. Awesome here with some super swaps for your daily dose of vitamin C. Forget those sometimes acidic oranges. Let's talk about some seriously delicious and healthier alternatives. Bell peppers, especially the red and yellow ones, pack away bigger vitamin C punch than oranges. Plus, they're gentler on your tummy, meaning no more heartburn. And they're great for your heart health too. Win-win. Then there's kiwi. These little guys are vitamin C powerhouses, super easy to digest, and won't erode your tooth enamel like some citrus fruits can. They're also bursting with other nutrients, making them a fantastic addition to your diet. So ditch the oranges, occasionally of course, and give these vibrant, healthy alternatives a try. Your body and your taste buds will thank you. So, you still want to enjoy your oranges, huh? Smart. Here's the lowdown on making it work for you. Avoid eating oranges on an empty stomach or right before taking medication. That's a recipe for potential tummy troubles. Try diluting your orange juice. A 1-1 mix with water is a great starting point. It'll still taste amazing, but be much gentler on your system. And timing is key. Aim for midday, not too close to breakfast or dinner. Finally, don't forget to rinse your mouth after enjoying your citrusy treat. This simple step helps protect your pearly whites from the acidity. Enjoy your oranges responsibly. 4. Avocados. Superfood or sneaky weight gain for those over 60? Avocados. Heart healthy or hidden hazard for seniors? Avocados have been lauded as a superfood, packed with healthy fats, fiber, and vitamins. But for seniors, uncontrolled avocado consumption can lead to unexpected health risks, especially if you're on medication or have underlying health conditions. Let's look at 3 reasons why avocados might not be the best choice for those over 60. Calorie bomb. One medium avocado packs around 240 calories. That's almost a whole meal. As we age, our activity levels and metabolisms slow down, meaning we need fewer calories. Regularly munching on avocados can lead to unwanted weight gain, putting extra strain on your joints, heart, and potentially worsening diabetes. Think of Robert, a 75-year-old from Denver, who added an avocado to his morning toast thinking it was healthy. 3 months later, he'd gained 12 pounds, significantly worsening his knee pain. Ouch. Medication mayhem. Avocados can interfere with how your body absorbs and processes certain medications, including blood thinners, like warfarin, blood pressure medications, and antidepressants. This is because avocados affect liver enzymes, CP450, potentially making your meds less effective or even more toxic. It's always best to chat with your doctor or pharmacist before making significant dietary changes, especially if you're on medication. Latex allergy link. Avocados contain proteins similar to those found in latex, leading to what's called latex fruit syndrome. Around 6% of people over 65 have a latex allergy, and avocados can trigger reactions ranging from itching and rashes to difficulty breathing and even tongue swelling. In severe cases, a life-threatening anaphylactic shock can occur, even if you've eaten avocados without issue in the past. The scary thing about allergies in older adults is that they can develop later in life, even if you've previously tolerated a food without problems. So, while avocados are nutritious, it's crucial for seniors to be mindful of portion sizes and potential interactions with medications. If you have any concerns, talk to your doctor or a registered dietitian before adding avocados or any new food to your diet. They can help you determine if avocados are a good fit for your individual health needs and circumstances. Expert geriatric advice: swapping out butter safely. Butter alternatives offer similar benefits with fewer risks. Let's explore some delicious and healthy options. Extra virgin olive oil. This is a fantastic choice. It's packed with good fats, making it easy to control your portions and minimizing the chance of any medication interactions. Plus, it adds a wonderful flavor to everything from sautéed veggies to a simple piece of toast. Walnuts and almonds. These nuts are nutritional powerhouses. They're great for your heart, brimming with omega-3 fatty acids, and less likely to cause allergic reactions than some other alternatives. A handful sprinkled on your yogurt, salad, or even enjoyed as a snack is a simple way to boost your health. Remember to check portion sizes though. A little goes a long way. They're also a great source of fiber, which is important for overall digestive health. So ditch the butter and embrace the nutty goodness. Safe avocado snacking. a friendly guide? Want to enjoy avocados but want to be safe about it? No problem. The key is moderation. Aim for only quarter to half an avocado a day, max. Think of it as a delicious addition to your meals, not a standalone snack. This helps your body absorb the nutrients more smoothly. After you eat your avocado, keep an eye out for anything unusual. A little tummy ache is one thing, but if you notice any allergic reactions, like itching or rash, feel unusually tired, or get seriously bloated, that's a sign to slow down. And if you're taking any long-term medications, it's always a good idea to chat with your doctor or pharmacist before making avocado a regular part of your diet. They can give you personalized advice and make sure everything works together perfectly. Enjoy your creamy, healthy goodness responsibly. 5. Watermelon. A refreshing treat, but potentially problematic after 60. Watermelon. A refreshing summer treat, but with a few caveats. Watermelon is a summertime favorite for many seniors, offering a sweet, juicy, and easy-to-eat treat on those hot days. However, for those over 60, especially those with heart, kidney, or diabetes issues, enjoying watermelon requires a bit more caution. Let's look at 3 main risks. Water overload. Potential for swelling and breathing difficulties. Watermelon is about 90% water, which can easily lead to fluid retention if you're already taking diuretics, have heart failure, high blood pressure, or kidney problems. Think of it like this. Your body might struggle to process all that extra liquid. For example, 78-year-old Betty from Arizona loved eating watermelon to cool down during the summer. After a few days of indulging, she found herself short of breath and with swollen feet, requiring a hospital visit due to fluid buildup and worsening mild heart failure. It's a good reminder to listen to your body. Rapid blood sugar spikes, a concern for diabetics. Watermelon has a high glycemic index, GI 76, meaning it can cause your blood sugar to jump quickly. 2 cups of watermelon can have a similar effect on blood sugar as a sugary soda. Definitely something to be mindful of if you have diabetes or prediabetes. It's not about avoiding watermelon entirely, but rather being aware of portion sizes and monitoring your blood sugar levels. High potassium levels, a risk for kidney patients. Potassium is essential, but if your kidneys aren't functioning optimally, and many seniors don't realize they have mild kidney issues, excess potassium can build up in your blood. This can lead to irregular heartbeats and, in severe cases, even cardiac arrest if not addressed promptly. The scary part? Almost 40% of people over 65 have reduced kidney function without even knowing it. So, while watermelon is a delicious and hydrating fruit, it's important to be aware of these potential risks, especially if you're a senior with pre-existing health conditions. Moderation is key, and always consult your doctor or a registered dietitian if you have any concerns about incorporating watermelon into your diet. They can help you determine the right amount for you and ensure you enjoy this summer treat safely. Expert advice from a geriatric specialist. Cool swaps for watermelon in the heat. Need a refreshing alternative to watermelon this summer? Here are some great options that offer similar benefits without the potential downsides. Cucumber. Sliced and chilled. Think super refreshing and hydrating. Cucumbers are low in calories, practically sugar-free, and won't leave you feeling bloated. Perfect for a light and healthy snack or a refreshing addition to your lunch. Frozen berries, strawberries, blueberries, etc. These little powerhouses are bursting with antioxidants and offer a delicious, icy treat. Plus, they're lower in sugar than many other frozen desserts and won't spike your blood sugar levels. Pop them in a smoothie, eat them straight from the freezer, or blend them into a refreshing sorbet. They're a fantastic way to beat the heat and give your body a healthy boost. So you're craving watermelon? Awesome. Let's make sure you enjoy it safely. The key is moderation. Think of it like this: half a cup at a time, and no more than once a day. That way, you get the delicious refreshment without any unwanted side effects. To help your body process all that natural sweetness, pair your watermelon with a little protein. Think some low-fat cheese, a handful of nuts, or even a dollop of Greek yogurt. The protein helps slow down the absorption of sugar, keeping your blood sugar levels happy. And finally, try to avoid watermelon after 6 p.m. This helps prevent that nighttime water retention that can lead to bloating and puffiness. Listen to your body. If you notice any signs of trouble, like swollen ankles, shortness of breath, or persistent bloating, stop eating watermelon and reach out to your doctor if you're concerned. Enjoy your watermelon responsibly and stay hydrated. 6. Is papaya a digestive superhero or a sneaky villain for those over 60? Papaya, a health food with a few caveats. Papaya is often touted as a digestive aid, helping with regularity and preventing constipation. However, for seniors, enjoying this delicious fruit without caution can lead to digestive upset, dangerous drug interactions, and even sudden allergic reactions. Let's look at 3 key risks for older adults. Medication interactions. Papaya contains papain, an enzyme that helps digest protein. Sounds great, right? But this enzyme can interfere with how your body absorbs certain medications, particularly blood thinners, like warfarin, diabetes medications, and some antibiotics. The result? Your medication might become less effective or even cause unexpected adverse reactions, all because of a seemingly harmless fruit. Consider Helen, a 71-year-old from San Diego. She ate papaya daily for better digestion, but within weeks experienced erratic blood pressure and needed a medication adjustment. Her doctor traced the problem back to the papaya interfering with her medication. Allergic reactions. This is especially important for those sensitive to latex, the stuff rubber gloves are made of. Papaya, like avocados, contains proteins similar to those found in latex. About 35% of seniors with latex allergies also react to papaya, even if they've eaten it without issue in the past. These allergies can appear suddenly in older age, manifesting as itchy mouth and swollen lips, difficulty breathing, chest tightness, or even a life-threatening anaphylactic shock in severe cases. Digestive distress. While younger people usually handle the papain enzyme in papaya with ease, older adults often have more sensitive digestive systems. Many people over 60 find that eating papaya leads to bloating, gas, diarrhea, or heartburn, the exact opposite of the intended effect. The Journal of Geriatric Medicine even points out that eating papaya on an empty stomach increases the risk of digestive problems in people over 60. So, while papaya offers potential benefits, it's crucial for seniors to be mindful. Moderation is key, and always consult your doctor if you have concerns about incorporating papaya into your diet, especially if you're taking medication. Expert tip: ditch the papaya and try these safer, gut-friendly alternatives. Papaya can be a bit harsh on some systems, so let's explore some gentler options for better digestion. Yogurt, unsweetened. This is a probiotic powerhouse. Probiotics are the good bacteria that keep your gut happy and healthy, helping with digestion and overall gut flora balance. Think of it as giving your tummy a friendly army of helpers. Fermented veggies, kimchi, sauerkraut, etc. These are amazing for regular. They're packed with beneficial bacteria and naturally help things move along smoothly. Plus, they add a delicious tang to your meals. Ginger tea. This is your go-to for soothing an upset stomach. Ginger has natural anti-inflammatory properties that can calm down bloating and nausea. It's readily available, super affordable, and tastes great. Win-win-win. You can even add a squeeze of lemon for an extra zing. So next time you're looking for digestive relief, skip the papaya and try one of these delicious and effective alternatives. Your gut will thank you. So you still want to enjoy some papaya? Smart. Here's how to do it safely. Don't eat it on an empty stomach. Always have something else with it. Start with small portions, maybe 2 to 3 small slices at a time, to see how your body reacts. And super important, check with your pharmacist about any medications you're taking. Papaya can sometimes interact with certain drugs, so it's best to be sure. Finally, listen to your body. If you notice anything unusual like itchy mouth, nausea, or unusual diarrhea, stop eating papaya immediately and talk to your doctor. Better safe than sorry, right? Enjoy. We just covered 6 seemingly harmless fruits that can seriously impact the health of people over 60. But don't worry, knowledge is key. Knowing what your body needs and doesn't need is the first step to a healthier, more active, and happier life in your golden years. Share in the comments. Have you ever had an unexpected reaction after eating fruit? Do you have a safe and delicious fruit alternative? Don't forget to follow for more videos, where I'll share the best fruits for seniors, healthy eating tips, and daily wellness secrets. Because healthy aging isn't about luck, It's about knowledge and smart choices every day.